Hi, Austin Mayor Steve Adler. Got a minute? All right, so today we move to Red Stage 5, Red Risk Level Stage 5. I'm going to talk about the numbers a little bit so you can see why it is that Dr. Escott recommended that and why I issued an order today consistent with that together with County Judge Andy Brown. Nearly identical, if not identical, orders. But we'll talk about the numbers, why that happened. We'll talk about the orders themselves and what they say, not mandating behaviors as part of these orders, but strongly recommending a change in behaviors. And I'll show you some of the modeling from the University of Texas so you can see the kinds of information and data that Dr. Escott and we were looking at. Again, I'm in control here of the elements of the broadcast, trying to let my staff enjoy the holiday, except for Stella. Thank you, Stella. But let's go ahead and take a look at the numbers, and we can get started. Let's begin with the the dashboard that we always start with. Most importantly, take a look at the new admissions in the left-hand corner, 77. That's the highest number that we've had for a while. That's a daily number. That daily number of 77 has moved us up to a 7-day moving average of 58. Remember, Dr. Escott was going to consider moving into stage 5 when we broke 50. Clearly, we've broken 50 now with a 7-day moving average. We were bouncing around between 48 and 50. We're clearly holding on to 50 right now. And with the number of new cases that we've been having here lately, 672 cases yesterday. If history is an example, those large number of cases kind of move their way through the system and they start showing up as hospitalizations. So we would anticipate that the 7-day moving average for hospitalizations would continue to rise. The number of new cases we have today, 375. If you look on the right-hand page, 375 is below the 7-day moving average, in part because we had a number like 672 yesterday. 375 is still a lot compared to where we were just at the beginning of December. You can see that was the summer surge that we had back on July 7th. Came back down, moved back up, and now we've crossed over into the red area again. 7-day moving average of 58. The infectivity in the city right now, 9.9. That means of all tests week before this current week, almost 10% of the people taking tests are showing up being positive. Think about that when you walk out on the street and you just are around people. If that population is like the population that's taking the testing, then 1 out of 10 people that you're around may very well have the virus. It's that prevalent in our community right now. Those are the numbers in green down at the bottom. Tells you what the 7-day moving average is. ICUs is what we focus on the most, 90. It was less than 2 weeks ago that we had the number of people in our ICUs were in the 70s. We're not at that place anymore. Let's take a look at the other dashboard to see exactly how many people are in fact in the ICUs tonight. The number is 94. We were at 90. It's the highest number tied we've had here recently, but again, less than 2 weeks ago, we were in the 70s, people in our ICUs. We only have 200 ICU beds that we can staff well in this city. If that ICU number goes up above 200, then we're really struggling at that point. Somebody has a heart attack or a car accident, and they try to rush them to the ICU, just won't get the care that you would want them to be able to get if we had a free and open up space. Right now, our ICUs are fine. The problem is, or the challenge is that the conditions we have today, the people getting sick today, are the people that'll start showing up in our hospitals in a week to 10 days, 2 weeks. Hospitalizations a week and a half to 2.5 weeks, and we can't change that over the next 2 weeks. So whatever rise we have is kind of baked in at this point. The number of people hospitalized today, 373. That's higher than our 7-day running average of 335. We have more people on ventilators right now than is our 7-day running average of 50. We passed 47,000 total cases, deaths of 528, which is 3 more than the number of people that we had pass away that had died. So 3 more people passing away just a couple days before Christmas. One of the reasons in talking to Dr. Escott about why it was he wanted to move us into stage 5 was his concern that not only did we see our numbers going up, but we now are moving into 2 holidays. Christmas, obviously, in a couple days, and then a week after that, New Year's Eve. And what he did is he worked with a modeler at the University of Texas, and he asked the question, what kind of situation are we in as a community if we have the same kind of spike for Christmas that we had for Thanksgiving? Of course, the numbers were a lot lower in early November as we moved into Thanksgiving. So we had that spike, and basically we were able to stay below the 50 mark in the red stage. But what if we had that same kind of Thanksgiving spike now with Christmas starting at an already elevated place? And then what if on New Year's Eve we have yet another Thanksgiving spike, this time associated with New Year's Eve? And what if that's happening on top of a spike that's associated with Christmas? And it's that potential for 2 more spikes on top of an already elevated place, I think that really has Dr. Escott concerned about what that could very quickly do to the ICUs in our city. Let me show you what the University of Texas modeler gave us, and let me see if I can find that page so you can see the same kinds of things. This is one of the University of Texas's models, and there's probably a way for me to really show this to you. Here it is. This is looking at hospitalized patients, and it's looking at it through January 20th of 21, so into January. The dots you see are the actual number of hospitalized patients we have. You saw just a second ago that we have 373 patients in our hospitals tonight. And the question is, what happens out front in the future? If we continue at the same trend that we're on, it's this blue line, and you can see the total number of patients in our hospitals as we get into January 20th is a number just over 500. But what if we have 1 bump with Christmas? What if we have 2 bumps, 2 surges, both Christmas and at New Year's Eve? What happens to our numbers then? There are lots of different scenarios, and in this dark area are the scenarios that the modeler tells us. Within a 95% accuracy, the number's going to be, trend line's going to be somewhere in here. These lines that you see are the mean lines or median lines, that demonstrate, kind of what is I'm not sure most probable the statistician would agree with, but what's the median line of all the different variations? This is current behavior, but if we have 1 bump, you can see we get up to approaching 1,000. If we have 2 bumps, then our folks in the hospitals get up to just over 1,000 people. Let's look at ICUs. Remember, this line here, 200, is really what our capacity is. It's not our physical capacity, but it's the staffing capacity. You know, when El Paso, and you saw their numbers before, went off the charts, the state was able to bring in, both state and federally, 1,000 healthcare workers. And that's how El Paso was able to deal with the surge that they had. The concern is that when we hit our surge, if we were to hit a surge, we're going to hit our surge at this point, it looks like, after Dallas, after Houston, after San Antonio, and all the healthcare workers probably going to have to be deployed to those other cities. And by the time they get to us, it's not clear that the cavalry will be there on the hill to come and help us. And 200 is what we can do with the staffing capacity that we have in our city. We continue in the current trend where we are, as we get to January 20th. While there are lots of scenarios that will have us above the 200 line, the median line has us staying below 200. But look what happens if there's a bump for Christmas, like the one we had for Thanksgiving. Look what happens if there's a bump on New Year's Eve, also like the one we had on Thanksgiving. Well, we could find ourselves above that 200 line pretty early. We could find ourselves above that line sometime right after, the 1st of January, I think like January 7th. And that's going to be baked in over these next couple holidays. So that's one of the reasons why Dr. Escott wanted to move toward that policy right now of changing behaviors, because if we're going to impact these two lines, then it's something that we have to start doing now. We can't wait. It's something that has to happen now. Let me show you the last one of the charts that we have. Let me see if I can pull that up here to show to you. This is mortality or deaths. You saw tonight that we had 3 people that died here a couple of days before Christmas. Again, the 3 lines, our current trend. You can see that under our current trend, if we don't stop it, this is our current trend, assuming no bumps for Christmas or New Year's Eve. In January, we're going to start looking at a place where we're having over 10 people a day that are passing away. And that number goes up even higher if there's a 1-week bump at Christmas, one-time bump at Christmas like Thanksgiving, and it gets up closer to 20 if we have 2 bumps compared to the 3 that we're at right now. And again, this is a 2.5, 3 week lag time. So if we're going to impact this kind of stuff, it's going to be through behaviors that we start doing here. And that's why we're talking to people in the community about changing behaviors. And the behaviors that we wanted to do, and I'll go through these in greater detail, we're asking people to consider, not mandating, but strongly encouraging. No gatherings with anybody outside of your household. Really trying to limit dining and shopping to really essential trips, avoiding non-essential travel. Really asking businesses to try to operate through contactless options like curbside or delivery. And we'll go ahead and talk about those kinds of options. But that's what we're looking at here, kind of in a stage red situation, and to go through it kind of in detail. And we issued the orders today, and it's online, and you can see the exact wording. But basically, we're asking people to stay at home and in their residence, especially between 10:30 at night and 5 o'clock in the morning. 10:30 at night to 5 o'clock in the morning. Try really hard to be at home. What Dr. Escott is telling us is that he's not really seeing a lot of transfer of the virus among strangers. Most of the transfer that they're seeing right now is occurring between extended family members and people and their friends. It's people that are getting together socially or getting together to go eat with one another or be with one another. And the problem is, or the challenge is that people don't wear their masks. People wear masks, generally speaking, when they're around people they don't know. But as soon as they get around friends, not in their household, or family members, not in their household, they don't wear masks. Maybe you don't want to offend your friend or your family member. Maybe you think at some level because you know them, they're not going to, carry the virus. And that's just not how this virus works. So trying to minimize those kinds of social contacts and gatherings. Individuals highly encouraged to utilize drive-through, to utilize delivery or takeout, curbside pickup services, to really focus on that contactless things. We looked at restaurants, and we suggested and strongly encouraged restaurants to close indoor dining. Don't eat indoors at a restaurant is the recommendation. Limit outdoor dining if you're going to do that outside to only 50% capacity. Asking people in restaurants not to let people eat at counters or at bars. Again, increasing drive-through, curbside delivery services, takeout. And again, ending all dine-in services, including outdoor, between 10:30 and 6 a.m. When we have rules and regulations that look at restaurants, it's not that Dr. Escott is saying that there's something inherently risky about those locations. It's not the location, it's the behavior. And the specific behavior is whether or not people are wearing masks. When you go to a restaurant or you go to a bar, and right now there are a lot of bars opened as quasi-restaurants under the exception that the governor has put in his rules. In those bars and restaurants, by the very nature of being in a bar and a restaurant, you're just not wearing masks all the time. So you're actually face to face. Even with some distance, you're face to face with somebody that's not wearing a mask and you're not wearing a mask. And it's that behavior that presents the risk. It's not the location. What we find is that if people are interacting and are wearing masks, both of them, the chances that the virus will transfer much lower than if one or both are not wearing masks. The new orders talk about retail businesses recommending that they limit indoor occupancy to 50%. Now remember, restaurants we're recommending not eating in a restaurant inside at all. Retail, okay, but only to a 50% occupancy. The reason for that is that when you go into a store in a retail and you're inside, you should be wearing your mask all the time, unlike in a restaurant and a bar. We're recommending that retail establishments and people going to retail establishments be careful to queue up and line up, standing in line, always trying to maintain 6-foot distancing. Try to the best you can to use drive-through, curbside delivery services, takeout, and we're asking people to make sure that they really do that only after 10:30 to minimize the number of employees that are working within 6 feet of one another. And then Dr. Escott also looked at and asked us to include in our orders, and we did, some really strong recommendations for schools. What they're finding is that most of the infections in schools are not happening in the classrooms, because in the classrooms people are wearing masks, but it's happening in extracurricular activities where masking and distancing isn't possible. So the recommendation is to eliminate extracurricular activities where masking and distance is not possible, or to be really, really stringent about instituting proactive testing. so that the moment anybody in that environment might have the infection, you can find it real quickly before it has a chance to spread. To try to, in schools, really try to eliminate any face-to-face activities where masking is not possible, and asking to modify the food service practices to space everybody out 6 feet apart when they're eating. So the rules we have right now in these orders are recommendations. They're not mandates, but they are strongly encouraged. And the hope is that there'll be enough compliance with this so that we don't have to do more. But we've all agreed that if we have to do more, we have to consider making things mandatory or whatever it is, that's something that we'll consider in order to be able to save lives in the community. We'll do whatever it takes to keep our community safe. But throughout this process, it's been people's willingness at crunch times to really do what was necessary at the end of March and into April and July. And now we're coming up to another crunch time here as we head into Christmas. It's our third crunch time. Every time we've had a crunch time so far, the community has responded. And the hope is that in this third crunch time, the community will respond yet again. I mean, we are so close to the vaccine. We need to work together. Just what I hope will be one last crunch time to hold on a little bit longer. Vaccines are already being distributed. It's going to be distributed to more and more people. A lot of people are going to have it by the end of February. A lot of the people that are most at risk will have it by the end of February. It's by our actions together, especially over the holidays and this crunch time, that we really can protect our hospitals from getting overwhelmed. We have to focus on future holidays with our families being all together. The really powerful element about this moment is that we control our future. It's within our control. This is not something that just happens to us. We get to decide by our collective actions what it is that happens to us. Big rule, wear a mask. Wear a mask when you're with anyone you don't live with. Simple rule. If you're around somebody you don't live with, I don't care where it is. If you're around somebody, you don't live with them, you guys should be wearing masks. Wash your hands, watch your distance, and again, wear a mask. Cover your coughs and sneezes, clean frequently, touch surfaces, and absolutely stay home if you are sick. Urge everybody to stay safe over the holidays. We are so close to the vaccine. Don't jeopardize future holidays for this one. Celebrate just with your households. As you look forward and toward New Year's Eve, probably best to be making plans right now to celebrate New Year's Eve and midnight alone with your family, the folks that you live in your household with. Push the furniture back, create a dance floor in the living room, and try to celebrate that way. I also know that it's probably likely that some people will be gathering or traveling with plans already set, and if that's going to happen, please try to do it in the safest way possible. Limit your gatherings as much as you possibly can. Don't go door to door caroling. Be outside as much as you possibly can. Maintain your distancing. Remember free testing at Austin Public Health. Avail yourself of that opportunity. We're going to take a few days off. We're going to be meeting the medical people this weekend, the Emergency Operation Command, as we take a look at these numbers. If anything comes of that, then I'll alert you in social media about gathering up together again. But for right now, we'll continue to watch the numbers. We set up this early warning system so that we would have an indication early enough to be able to impact our future. And that's where we are. We have time, but we have to respond. You all take care. Be safe. Enjoy the holidays. And good night.